Welcome back. In this section, let's do what the respiratory system does. Let's breathe and learn about breathing. So when we're talking breathing, we are talking about two phases of ventilation. Inspiration, also known as inhalation, and expiration, also known as exhalation. So the first thing to talk about how we breathe depends on which type of breathing we are doing. We have two general types. The first is the type you are doing as you're sitting there listening to me drone on about breathing, and this is known as quiet respiration because you don't hear anybody going in the background. Maybe that's why they named it quiet, I don't know. But what it means, it's very relaxed. It's kind of breathing that's unconscious. You're doing when you're sleeping. It's automatic. You're just doing it all the time. In contrast to quiet breathing, the other type is called forced respiration. And this is when we are doing deep breathing, as in when I say take a deep breath, or blow out those candles, or if we're doing rapid breathing, because that is changing our normal quiet respiration, either in volume or rate. So in order to understand how breathing occurs, we need to understand just a little bit of physics known as Boyles Law. You don't need to know the name Boyles Law, but you need to know this concept. And I'm sure you already understand this concept, but I'm going to review it just to make sure we're all on the same page. This is showing, for instance, a space, which in this case has 9 red balls in it. And those 9 red balls in this confined space have a certain amount of pressure in this space, as indicated by this dial. So this dial is indicating that the space is pretty big and there's lots of room for the 9 red balls, and so the pressure is pretty low. Now, what's going to happen if we take that plunger to the right and we push it? And now we still have the same 9 balls. I'm assuming it was 9, maybe it was 10, I didn't count. So we still have the same amount of balls, but in a much smaller space. Then the pressure goes up. So Boyles Law basically says you have high pressure when low volume, and when the volume goes up, the pressure is lower. All right, so knowing that, let's talk about what muscles are involved when you are doing quiet respiration, specifically the inhalation. Because what happens in inhalation is not what happens in exhalation, whether it's quiet or forced. So in quiet inhalation, in order to understand what's happening, let's go back and look at what your rib cage looks like. So everybody knows that you've got these ribs, and everybody thinks that these ribs are horizontal in that beautiful transverse plane. And I want to show you the side view where you clearly can see that the ribs are angled in a downward direction. Just like, for instance, in this rusty pail where the handle is a rib in a downward direction. Now, when these ribs are angled in the downward direction, the circumference of your rib cage, the diameter in the transverse plane and the diameter in the anterior posterior plane is fixed with the rib in that direction. Now, what happens to the diameter when you lift the ribs is the same concept that's going to happen with the diameter when you lift the pail bucket's handles, in that the diameter will increase in both the transverse side-to-side plane as well as the anterior posterior plane. So how do we get the ribs to elevate? Well, we contract your external intercostal muscles and your ribs raise up, thereby your chest cavity getting larger in 2 dimensions. However, there still is another dimension, and that is the superior-inferior dimension, and that is going to be affected by your diaphragm that the ribs sit on. So, at rest, your diaphragm has a slight arch to it. So my question to you is, when that diaphragm muscle contracts, when those muscle fibers contract, what's going to happen? Is that diaphragm going to get a bigger arch, pushing the lungs up, or is that diaphragm going to flatten? Now, when I asked this question at the beginning of the lecture on respiratory system, I will tell you that 80% at least of people will pick this. But I think if you compare the length of this as the starting point, that the muscle would have to get longer to get more domed, and this is shorter than this. So when the dome diaphragm muscle contracts, it must flatten. And by flattening, that allows the lungs to have a bigger superior inferior dimension. So now we have increased our thoracic cavity in all three planes, the X, the Y, and the Z plane. By increasing the volume, what has happened to the pressure? Go back to Boyles Law. It has plummeted. So the decrease in thoracic pressure means that this has a lower pressure than the atmospheric pressure. Thereby, the air is just going to rush in because it wants to go to a place with a lower pressure. You are not having to suck in order to inhale every time. Your external intercostals and your diaphragm are contracting, making this space bigger, and the air is passively flowing in. The air is not pushing the volume bigger. So that's how inhalation occurs. Now, how does exhalation occur? Well, we want those ribs to plummet. How are we going to get those ribs to fall? We're going to relax our external intercostal muscles. How are we going to get the diaphragm to plummet? We're going to relax our diaphragm. Why do the lungs not totally collapse on themselves? Because our friend surfactant prevents that total collapse. And so no muscles contract for quiet exhalation. It is just the relaxation of the contracted muscles of quiet inhalation. So what happens when those muscles relax is this volume gets smaller, the pressure is higher, that makes the air rush out. Now, what if you want to take a big breath because you want to swim underwater for a distance? Well, then let's do forced inhalation. So everybody take a big breath. Do you feel any other muscles moving? Do you feel anything different? Are you feeling muscles move? Well, we're still going to have our external intercostals and our diaphragm contract, but now we're going to pull in some accessory muscles of inhalation, which you learned about when you learned about your muscles. Your sternocleidomastoid, which is going to elevate the manubrium and pull it out a little bit. Your scalings with the anterior middle scaling pulling up the first rib. Here's an extra tablespoon of air on each side. Then your posterior scaling pulling up the second rib. Here's another tablespoon of air on each side. Your pectoralis major, it's attached to 3 or 4 of your ribs, pulling them out even more. Let's have another tablespoon or 2 of air. And how about your serratus anterior muscles? Yes, they're going to pull on your ribs as well. So all these things are going to give you like an extra half a cup of air in each lung easily. Very useful. So after forced inhalation, when you exhale, all of these would relax. But now let's talk about forced exhalation, because with forced inhalation, you don't have to have forced exhalation. You could just have forced inhalation, feeling all this contract, and then just exhale normally when everything relaxes. Or we could have a normal inhalation, which I want all of you to do, but then I want you to pretend you're blowing out candles on the other side. So blow, 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 blow. Don't stop. Don't hold any air back. Blow, 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 blow. Where are you feeling muscles contracting? Yes. If you didn't do it, I want you to do it again. Ready? So no extra inhale, just normal inhale. Now blow, blow, blow that candle out from the other side of the room. Okay. I'm dizzy from all this forced inhalation and exhalation. But in forced exhalation, we are going to have passive relaxation of any muscles that were used in our inhalation, but now we're also going to involve our internal intercostals because they will pull our ribs downward, and we're going to involve all our abdominal muscles, which means your rectus abdominis, your external obliques, your internal obliques, and your transverse abdominis, all of them compressing your abdomen to push that diaphragm even higher. And don't forget the quadratus lumborum because it's attached to the 12th rib, so it can bring ribs down on the posterior aspect as well. So those are your muscles of forced exhalation. And with that, we are done with learning how breathing happens, and I'll see you soon.